Hello, I'm Sammy and I'm going to walk you through common signs of autistic spectrum disorder in young children. It's just 12 short slides with 10 common behaviours or indicators that could suggest that a child may be on the autistic spectrum. So let's dive in. When we're talking about young children, we're actually thinking about children in the 0 to 5 age range. That's what we're going to be focusing on as we move through this presentation. So without further ado, let's have a look at the first indicator. And that might be not responding to their name. A child may not react when their name is called, which could be a sign of a social communication difficulty, which of course in turn could be an indicator or a sign that they may be on the autistic spectrum. Avoiding eye contact. Children with ASD may avoid making eye contact, which could be an early indicator of a social interaction challenge, which in itself could suggest a child may be on the spectrum. Third up, we have not smiling when being looked at. We expect babies and young children, when adults make eye contact, especially familiar adults, when adults make eye contact with them and exchange facial expressions, we expect a smile to be returned. So a lack of a reciprocal smile or facial expressions in response to others' emotions towards the child or baby could be a sign of a social communication issue, which in turn could suggest that a child may be on the autistic spectrum. Getting very upset by certain sensory experiences, and that might be sounds, it might be smells, it could be tastes, it could be certain visual stimuli, and children with ASD may have a strong or a big reaction to tastes, smells, or sounds, as I said, indicating sensory sensitivities. Repetitive movements is definitely an indicator, or could be described as an autistic behaviour. This could include actions like hands flapping, finger flicking, body rocking, which are common repetitive behaviours which could be associated with ASD. Okay, we have delayed speech and language skills. So some children with ASD may not speak as early as their peers, and they may have difficulty per se developing language skills. So that could be another red flag or another indicator to look out for. Okay, and as children get older, from the age of 3 years old, we would usually expect children to be engaging in pretend play, the small world, role play, etc. And children who are not doing that by 3-4 years old or present a lack of imagination or are not engaging at all really in pretend play. Examples could be feeding a doll, etc., playing with animals in small world. This can also be a sign of ASD in young children. And I think we're up to number 8, having obsessive interests. Children with ASD may focus intensely on a specific topic or minutiae or a very specific object, showing repetitive and restricted patterns of behaviour. Children on the spectrum may get very upset by what we would consider minor changes. It could be changes in routine, could be changes in food on offer, could be changes in the layout of a room, for example, could be changes in terms of it's not the usual person picking them up or dropping them off, or not the usual person opening the door when they come into the classroom in the morning. Difficulties with transitions and unexpected changes in routines can be very distressing for children on the spectrum. We might also, this is number 10, we might also see unusual reactions to sensory stimuli, and this could include being oversensitive or underreactive to the way things sound, smell, or taste. And this could indicate sensory processing differences.